Treatment plan for stomach cancer patient will usually be decided by a team of doctors, which is why this is called multidisciplinary management. The different modalities of treatment are chemotherapy, surgery, radiation therapy, targeted therapy, and immunotherapy. Surgery is the removal of the tumor and the surrounding healthy tissues during an operation. The type of surgery used depends upon the stage of the cancer. For a very early stage like T1A cancer, treatment which is called endoscopic mucosal resection or endoscopic resection is the treatment of choice, which is where the tumor is removed by an endoscopy. In early stages like stage 1, when the cancer is still only within the stomach, surgery is used to remove the part of the stomach with the cancer and the nearby lymph nodes. This is called subtotal or partial gastrectomy. In a partial gastrectomy, the surgeon connects the remaining part of the stomach to the esophagus or the small intestine. If the cancer has spread to the outer stomach wall, with or without having spread to the lymph nodes, surgery is preceded by chemotherapy. The surgeon can perform a subtotal gastrectomy or a total gastrectomy, which is the removal of all of the stomach. During a total gastrectomy, the surgeon attaches the esophagus directly to the small intestine. Regional lymph nodes are often removed during the surgery because the cancer may have spread to these lymph nodes. This procedure is called lymphadenectomy. The types of medications used for stomach cancer treatment include chemotherapy, targeted therapy, and immunotherapy. Chemotherapy is the use of the drugs to destroy the cancer cells, usually by keeping the cancer cells from growing, dividing, and making more cells. A chemotherapy regimen or a schedule usually consists of a specific number of cycles given over a set period of time. A patient may receive one drug at a time or a combination of different drugs given at the same time. The goal of the chemotherapy can be to destroy the cancer cells remaining after the surgery, to slow the tumor's growth, or to reduce cancer-related symptoms. It also may be combined with radiation therapy sometimes. Currently, there is no single standard chemotherapy treatment regimen that is used worldwide. However, most chemotherapy treatments for stomach cancer are based on combination of one of the following drugs like cisplatin, oxaliplatin, and fluorouracil. Your medical oncologist will be the correct guide for the best line of chemotherapy for the patient. Targeted therapy is a treatment that targets the cancer's specific genes, proteins, or the tissue environment that contributes to the cancer's growth and survival. This type of treatment blocks the growth and spread of the cancer cells and limits damage to the healthy cells. Not all tumors have the same targets. To find the most effective treatment, your doctor may run tests to identify the genes, proteins, and other factors in your tumor. This helps the doctors better match each patient with the most effective treatment whenever possible. In addition, research studies continue to find out more about specific molecular targets and new treatments directed at them. Targeted therapy for stomach cancer includes HER2 targeted therapy and Anti-Angiogenesis targeted therapy. Some cancers may make too much of a protein called human epidermal growth factor receptor 2, HER2. This type of cancer is called HER2 positive cancer. Trastuzumab plus chemotherapy is an option for people with later stage of HER2 positive stomach cancer. Anti-angiogenesis therapy is focused on stopping angiogenesis, which is the process of making new blood vessels. Because the tumor needs nutrients delivered by the blood vessels to grow and spread, the goal of anti-angiogenesis therapy is to starve the tumor. For patients whose tumor has grown while receiving initial chemotherapy, these medicines may be an additional option and may be given either in combination with paclitaxel or by itself. Immunotherapy uses the body's natural defenses to fight cancer by improving the immune system's ability to attack cancer cells. For people with advanced HER2 negative, PD-L1 positive stomach cancer, treatment with the immunotherapy like nivolumab in combination with chemotherapy is preferred. Nivolumab is a type of immunotherapy which is also called immune checkpoint inhibitor. that helps body's immune system target and destroy cancer cells. For patients with advanced stomach cancer, that is MSI-H, pembrolizumab, nivolumab and dostarlimab are options when chemotherapy does not work. Different types of immunotherapy can cause different side effects also. Common side effects include skin reactions, flu-like symptoms, diarrhea, hypothyroidism, and weight changes. Talk with your doctor about possible side effects for the immunotherapy which is being recommended.